Are you losing weight and worried during or after cancer treatment? In this video, I'm going to talk about cancer cachexia, what it is, what it means, and the importance in terms of outcome. Before I go on, I'd love you to subscribe to our channel. We're always putting out new content, so there's always something new to watch. Cancer cachexia is a specific metabolic syndrome that leads to loss of muscle and weight. It actually leads to what we call wasting. If you have this image of somebody with cancer in your mind who is wasting at the temples or in the face, elsewhere in the face, people who are super skinny during cancer treatment, you're probably looking at somebody experiencing cancer cachexia. This is different from weight loss from breast cancer chemotherapy in people with early stage breast cancer or people who lose weight because they're trying to lose weight. So I want to make this important distinction between weight loss during treatment and cancer cachexia. Cancer cachexia is a whole body syndrome driven by the metabolic process underlying cancer itself. So when we see people in our mind's eye or in person, maybe you see people where you're getting your treatment who look wasted, it's very likely that they have advanced cancer. If you are experiencing this yourself, it's not likely to be from the cancer treatment, but rather the cancer itself. And I know this can be hard to hear. Cancers secrete all sorts of chemicals that not just suppress appetite along with treatment, which can make things not taste good or reduce your appetite. But the cancer cells actually create muscle breakdown. It's called cancer cachexia, as I mentioned. Cancer can be a catabolic process. This is the funny thing. When we treat it, we actually can use steroids, which also break down muscle, but steroids are a great way to help people who are losing weight from cancer itself to actually gain weight and can stimulate appetite. So we're really careful about using steroids to stimulate appetite because of the effect of steroids on muscle breakdown. But if you are experiencing cancer cachexia or someone that you love or know is going through this, they may be offered steroids to boost their appetite and help with their weight. It's really a process driven by the cancer itself, and people with cachexia will have a reduced appetite, and telling them to eat more, it may backfire, because when people have cancer cachexia, food doesn't necessarily taste good. So if a loved one of yours isn't eating and you want them to eat and they don't want to, I have to say it's not very effective, and you may actually be setting up conflict. Having them see a nutritionist and explain what's going on in their body to you and to the person you love can be much more helpful than force feeding them, which can actually make people quite uncomfortable. This is a hard topic. I hope it's been helpful. If you're living with advanced cancer or you've been diagnosed with cancer at any stage, I'd love to invite you to go to Yerbba.com to get your personalized report. If you're living with advanced cancer, the feature called Ask Yerbba is particularly helpful because Yerbba will go over your medical records and respond to specific questions that you have after looking in detail at your records. Yerbba.com to get your personalized Yerbba report. Thank you, as always, for watching.